Michalski, and for my audience today, I have my mom Denise, my grandma Betty, my brother Dylan, my aunt Jen, my friend Debbie, and my friend Camille. Does everybody have their audience analysis?
Yes.
Okay, good. Now, for my speech. The topic of my speech today is nonverbal communication. The purpose of my speech is to inform my audience on how to pick up on nonverbal communication with people and how to identify the cues. Nonverbal communication is made up of many aspects, such as body movement, voice and paralinguistics, time, appearance, touch, physical space, and environment. Me, personally, as a nursing student, I have to be very well aware of nonverbal communication because I need to know how my patient is going to react with me and how we can cooperate with each other. According to Taylor in the Fundamentals of Nursing, it is said that nonverbal communication is the transmission of information without the use of words, termed as body language. It's hard to think you communicate with someone without actually speaking to them, but I will show you today that there are many ways you can tell and communicate with someone through body language and nonverbal communication. The first thing I will go over is body movement. As said by Pouyatis in Net Library, body movement depends on signs and signals on a somatic level, and it's not just the body itself, it's also the surroundings. Important signals of body movement are posture and facial expressions. These are considered the most important because they are the most revealing, and they are the most ones that you can pick on people's response to your talking. People notice how you carry yourself and hold your body. That's why posture is important. Like people that are healthy hold themselves with good alignment. People that are not so healthy tend to slouch. That's the difference. With facial expression, you give your reflection of your emotion to somebody. You can tell immediately what people are feeling by their facial expressions, especially if they're very expressive, like someone who is crying all the time or happy or smiling. But then there's also the shy people, which tends to be tricky because they have a very plain look about them. Along with this comes eye contact, along with facial expressions. When you give someone your eye contact, you are showing them respect and a willingness to listen. If you don't look at somebody, they can tell that you're trying to avoid them. Two other important signs of body movement are gestures and gait. Gestures are using your body parts to give out a message, and sometimes they can carry out more than once. You have to be careful. Example, if someone is tapping their foot while you're talking to them, it could mean anger, anxiety, or frustration. Let's say you're waving your hand at somebody. It can mean saying hi, telling them to stop or to leave, or signaling them to come on. All these are a way of communicating. You just have to know how to pick up that gesture. And lastly is gait. Gait is the way you walk that carries out a message. A bouncy kind of walk shows someone being well, and someone who is kind of shuffling and not bouncy, that means that they're sad or mad or sick or anything. And of course, limping means that you're in pain or you're hurt. Next, I will go over voice or paralinguistics. When I say voice, I know you're all like, wait, nonverbal communication, how is voice cut into this? What I mean is your tone and your pitch or any pauses you make while you're speaking. People notice these things. That's why I call it paralinguistics. Someone's tone can show hostility, fear, sarcasm, so many different things. People notice how you say something and not exactly what you say. Example, let's say I'm in a hospital and I have a patient who literally can't speak English and I need a translator. And I'm going back and forth between me, the translator, and the patient, and we're going, and and I still don't get the information I need. If I get to the point where I'm like, just tell him I need his medication, like, whatever I say, and that patient literally can't understand me, but he sees me going like this, he's going to know I'm frustrated, he's going to get frustrated with me, and we're not going to get anywhere. Another example is, have you ever fallen asleep in class, and your teacher, you don't hear a word they're saying, but as soon as they smack on that desk, and they're loud, immediately you're awake and you're alert. But you don't know what they say, but you know what's going on now. That's what I mean when I say voice. It's how something is said and how you hear it, not exactly what they say. Next thing I will talk about is touch. As said by Fortinash in Psychiatric Nursing, physical touch is influenced by a person's age, sex, cultural background, past experience, and current setting. You have to recognize the appropriate time to be able to touch somebody. You should probably ask yourself things like, am I that comfortable with them yet? Things like that. Touch is also signalized by where you touch someone. Like touch on the arm or the hand can signify like empathy or concern. Dealing with patients, you need to know the appropriate time to touch somebody. Like an example, if I have a schizophrenic patient and I can see them going into an episode, I'm not going to want to immediately go touch them. I'm going to need to see that personal space, because by touching them, I can set them off or make things worse. So I need to calm them down, but I'm not going to touch them. I'm going to try and talk to them. Another example with touch is, let's say that me and a doctor have to go into a room with the patient, and he has to give them bad news. I'm going to sit there and I might want to hold her hand and comfort her, so, because he's giving her bad news. I mean, why not? That's very nice. I need to separate these instances because there are pros and cons of touching somebody, by my example. Another thing I'll talk about is physical space. Now that I mentioned that space between my schizophrenic patient, I'll show you how to recognize that space. Physical space really depends on the person, but typically it is 18 inches and 4 feet. Everyone has their comfort zone with different measurements, but typically intimate settings, the space is smaller and you're closer together. While professional settings, you're farther apart and there's more space between you. As a nurse, I come in contact with many different people from many different cultures. So that's another thing I have to consider, is people have different cultures, so their space preference is different. Typically, I wait for my cue with my patient. I'll allow them to set the preference first. Like, I'll wait for them to come at me, and I will observe what they do, and then I'll just follow them, because I like to keep things comfortable, because like I said, everybody is different. The next thing I will talk about is physical environment. Along with, like I said, with personal settings, how there's intimate and professional, I will show you how you can recognize these settings or even create them yourself. There are elements such as mood and atmosphere that can affect the conversation. As a nurse, my setting typically would be bright lighting, but not bright enough to blind my patient. Also, another thing I would account for is the noise factor. Like, I wouldn't go talk to my patient in a loud, crowded waiting room. Remember, with creating an environment, you have to be careful. Like, let's say I'm in a room with a patient and I want to shut the door. I'm not just going to go shut that door. I'm going to ask permission, because let's say I shut that door, I'm going to scare them. And the last thing you want to do is have your patient scared of you. All these things can be limiting to a good environment. Another one is temperature. If your patient is hot or they're freezing, this can distract them and you're not going to get their attention. And like I said, these things limit a good environment, so not only distracting your patient, but also can distract you as well. Another thing is appearance. First impression does count. Appearance can say a lot about somebody, and it's not just what they wear. Is their hair done? Do they have makeup on? Are they showered? So many things go along with appearance. Typically, people in good health do pay more attention to these details. I mean, what they wear in their hair, things like that, compared to a sickly person who might not care all these details. Like, I know if I'm sick, my hair's not done, I don't have makeup on, and I'm in pajamas or sweatpants. Also, if a patient comes in with like sunken eyes and poor muscle tone, I know something's wrong just by their appearance. But back to the subject on what you wear as appearance, if I see someone in midsummer, one of my patients, in like a winter coat and a scarf, the first thing I'm going to assume is mental breakdown. That's why appearance is important, because I can see that. I know what I have to ask them, what I'm going to conversate them about. I mean, I am going to be assisting them, so this gives me a good idea. The last thing I will be talking about today is timing. Timing consists of two aspects. There is literal time, like morning, noon, and night, and by that I mean, is it early in the morning? Did my patient just wake up? Are they going to have their wits about them to be able to engage in my conversation? Or is it later and my patient is falling asleep on me? Timing in this aspect, these things factor are good things to know. And timing in life is the other aspect. To explain that, let's see, let me think of an example here. It's hard to explain. Let's say my patient is hysterically crying. I have to say, did they just receive bad news? I mean, they are crying, so obviously this is not a good time to go lecture them about something. Or let's say I have to go tell a patient that they have stage 4 cancer. There's never a good time for that, but I need to recognize the right time to say this. That's why timing in both these aspects have to be carefully considered, because I do need to maximize that time with my patient. So all in all, do you see how important it is to know nonverbal communication? Having knowledge to recognize these things is a plus, because like I said, everybody is different and has different cultures. In the healthcare field, cultures vary, and nurses have to be courteous and competent of that in these people. And do you see how everything I said did tie together? It's not just facial expressions you're going to notice. It's not just body movement you're going to notice. It's not just physical space. It's all these things will tie together. You're not going to have to just rely on one thing. You will notice nonverbal communication in some way. These things are important to know because they do enhance communication. Thank you.